We have been talking vaping with Dr. Eric Hamberger, Meredith Berkman, and her son, Caleb. And we've been talking about the epidemic. And Dr. Hamberger, to get back to you, why is vaping so bad for a teenager's lungs?
We used to think that lungs stop developing in early childhood. We're now learning that lungs develop from the time you are a fetus to the time you are an adult. So nicotine in e-cigarettes specifically affects everything from lung function to the ability to fight disease. We're finding that nicotine in e-liquids actually, as we're showing in this graphic, can actually have an effect on the alveoli, the air sacs at the end of the lungs, to resemble something like emphysema in mice. So very large air sacs with a diminished surface area, less area for gas exchange like oxygen and carbon
And
dioxide.
would it be fair to say, since we have such limited data, that we have no idea how much long-term damage teenagers are doing?
Absolutely, yeah. A lot of e-cigarette companies are kind of banking on that. You know, a lot of the bigger brand companies will say, well, it doesn't cause cancer because there haven't been any cases of cancer. Well, they've only been around for about 10 or 12 years. It doesn't mean that we won't see cancer. What we do know is that they cause, as with this current epidemic, they can cause very serious and irreversible lung damage, something called acute respiratory distress syndrome. It's caused hospitalizations, respiratory failure, in hundreds of young adults and teenagers around the country. There was a recent case where I work at UCLA where a child was vaping a cannabis derivative and ended up being hospitalized for about a week. So to say that these are safe or that they don't cause long-term damage, the science argues against it.
Now, I know at this point a lot of parents are saying, oh my gosh, I wonder if my child is vaping. What are some signs and symptoms parents can look out for?
I like to think about this in kind of three different categories. So there are the most common are the behavioral side effects of nicotine. So the irritability, behavioral changes, kind of difficulty concentrating, interrupted sleep. There are, of course, the respiratory side effects. So cough, dry cough is probably the most common symptom. Shortness of breath. Anecdotally, I've heard of mothers complaining about their children's exercise tolerance going down. And then there's kind of the common sense signs, the things that I mentioned earlier, like if your child is carrying around a USB device, or if they start to smell a certain way, if they're going to the bathroom a lot. Those are things to look out for.